One should, again, check in with the CDC website from time to time because these recommendations may change. But for now, you should avoid large crowds where they're congregated in one room. For patients that are older, more vulnerable, they perhaps should avoid transportation like airplanes and subways and so forth. At the moment, it absolutely is. First of all, we're a freestanding facility. We're not part of a hospital campus. Second of all, patients that come to see us are healthy, so it's unlikely you'd be coming into contact with someone that was here for systemic illness. Third, just because of the nature of our job, we're very particular about hand hygiene and about wiping down work surfaces as well as furniture and so forth. So for the time being, if you want to visit us at the Emory Aesthetic Center, I don't think you have anything to worry about. We also are required to have flu shots to be able to work at the Emory Aesthetic Center. And although that has nothing to do with coronavirus, I think it's testimony to the fact that we work really hard not to transmit any illnesses to our patients. Well, if you've had surgery recently, there can be things that are the consequence of the operation that could cause you to feel improper, and those patients should call their doctor. If ever you've not had surgery and you're not feeling well, we would ask that you postpone your appointment for several weeks until you feel better. Finally, if you've traveled to a place that has a high incidence, such as China or Italy or Iran, we would ask that you arrive home and remain disease-free for a couple of weeks before coming to visit us. Then we'd be glad to see you. It's true that some very large operations can be physiologically very hard on the patient and put their immune system a little bit weaker, but almost all of the operations that we do at the Emory Aesthetic Center are not of that nature. So for the vast majority of aesthetic procedures that we do, there's no contraindication to having it in the year of the coronavirus. The other thing, and this may be the lighter side of it, if you're healthy and you're thinking about having cosmetic surgery and because of the concerns about coronavirus, they're forcing you to work from home, it might not be a bad time to go ahead and get the cosmetic surgery done. One thing I would strongly advise, and that is to not get your information from politicians or from the media. Because it's an election year, a lot of this is hyped up and patients can be unnecessarily alarmed. The CDC has an excellent website and you can get day-to-day information on the spread of coronavirus and any new precautions that might need to be taken.